is one of the most important 12 cranial nerves. The vagus nerve originates in the medulla oblongata, which is part of the brainstem. It supplies nerve fibers to the pharynx, larynx, trachea, lungs, heart, and esophagus. It also supplies nerve fibers to most of the intestinal tract. The vagus also brings sensory information back to the brainstem from the ear, pharynx, larynx, and tongue. We get the term vagus from the Latin origin. Vagus in Latin means wandering. We use this because the vagus nerve wanders from the brainstem down to the colon. Okay. The first way we are going to test the vagus nerve is by asking the patient to say ah. Okay, Jenna, please stick out your tongue and say ah. An abnormal finding of this test would be the patient's uvula deviating to one side. Possible causes of this are brainstem tumor and neck injury or cranial nerve 10 lesion. The next way to test this nerve is by checking the gag reflex. We will do this by aggravating the patient's soft palate. Okay, Jenna, now I'm going to check your gag reflex. You could just stick out your tongue and say ah. An abnormal finding for this test would be no gag reflex. This could be caused by vocal cord weakness. The next test is to note the patient's voice quality. You do this by asking the patient to say a few words or a sentence. Jenna, please repeat the sentence after me. The dog flew over the moon.
The dog flew over the moon.
That would be an abnormal response. Abnormal responses are caused by soft palate weaknesses or unilateral cranial nerve 10 lesion. A normal response would be, Jenna, please repeat the sentence after me. The cat ran down the street.
The cat ran down the street.
The last way to test the vagus nerve is to note a patient's swallowing. To do this, you ask your patient to swallow while feeling their neck. Jenna, can you please swallow for me? Normal findings would be dysphagia or fluids regurgitating through the nose. This is caused by a bilateral cranial nerve 10 lesion.
Thanks for watching!